Hello, South Texas. It is great to be with you again for the South Texas News. Now, I know I can speak for the senior leadership team when I say that we are so proud of the amazing work that's happening across this healthcare system at every campus to continue our mission. From one screening, telehealth appointment, room modification, hand sanitizer, and smile at a time. We know that you will rise to the occasion because, simply put, that's what you do. So I'd like to get today's news edition started with a safety story from your Chief of Staff, Dr. Flynn.
Hi. This story is all about our South Texas employees and their can-do attitudes. For the past days, we've been full steam with plans to deal with a surge of patients due to this pandemic. We will discuss some specifics in a moment, but for now, I'll just say much heavy lifting is being done by an incredible number of staff members. On top of all that, ideas to keep all staff safe abound, and that's what I want to highlight. Staff have been contacting their supervisors and chiefs and the COVID-19 email group with ideas ranging from extending feeding tubing to mitigate risk, to fabricating face shields if needed, to ways of expanding our ventilator numbers and using areas such as our OR to expand our bed capacity. These are just a small list of the examples of the innovative ideas you all have shared, and I encourage all to keep them coming. I hope this story demonstrates the strong community of practice we have here at South Texas, as well as our efforts towards sensitivity to operations and resilience. Thank you.
Excellent. You've seen several messages from me over the last few weeks talking about the command center, but for many of you, this may be a foreign structure. That's because it only exists when it's officially activated by the medical center director. The South Texas VA uses the HICS, or Hospital Incident Command System structure, or command center. And there are several key elements of this structure. These include the incident commander, the leader of the command center. During this pandemic, we have two incident commanders who rotate coverage. To date, these individuals have been Tricia Lottie, our Chief Experience Officer and Assistant Director, and Dr. Evan Renz, our Associate Chief of Staff for Quality, Safety, and Value. Trish and Dr. Renz are responsible for coordinating the individual activities of several other critical branches of the structure. These include medical operations, planning, logistics, finance, and a myriad of other technical support roles. Today, Dr. Flynn and Valerie Rodriguez-Yu, our nurse executive, also the leaders of the medical operations branch, will share the amazing work that their team is doing to prepare the South Texas system to keep our patients and our staff safe.
First of all, Dr. Flynn and I want to assure you that the South Texas Veterans Healthcare System is working very closely with VHA VISN and central offices, the health department, and we're following CDC guidance in all that we do. We thank you for your flexibility as information and guidance changes, sometimes on a daily basis, and so we really appreciate your flexibility as information becomes available. We are learning from the experiences of other countries and states who have experienced an overwhelming number of patients affected by the COVID-19 virus.
Over the past few weeks, we've been planning for any surge of patients the hospital may receive. The first phase of the plan was to ensure all staff and veterans are screened before being allowed into what we've been calling our green zone of our campus. Thanks to the staff who, rain or shine, have been outside of our facilities, ensuring that our house is protected from this COVID-19 virus. This week we are rolling out 100% temperature checks in addition to the verbal screening already in place. At Audie Murphy, for veterans who screen positively, a more in-depth assessment occurs with a nurse practitioner on standby to direct the veteran either home, to the emergency department, or to the COVID clinic, which is located at the entrance of the doors leading to the spinal cord injury clinic. This clinic has been converted to provide negative airflow to the entire clinic thanks to our brilliant engineering staff. The Audie Murphy COVID clinic site will also serve as the drive-through testing area for veterans who require testing once more tests have become available.
The Kerrville campus has also implemented 100% screening, including temperature checks in addition to the stringent restrictions in place to protect the community living center residents. This virus is unforgiving. We must be prepared to care for an influx of veterans or humanitarians when the time comes to do so. MICU has already been caring for patients who are being ruled out for the virus, and I am pleased to report that South Texas Veterans Healthcare System has had no positive cases as of today.
Once the MICU reaches capacity, any additional influx of patients will be cared for between the PCU and 5A units. Again, our engineering department that has not hesitated to ensure the fifth floor is fully capable and safe to care for COVID-19 positive patients. This has involved ensuring appropriate air exchanges are achieved and safety systems constructed to prevent the spread of COVID-19 amongst staff. Your health and safety is our priority.
For the outpatient areas of care, virtual modalities are being maximized with MAS and clinical staff reaching out to veterans to meet their healthcare needs using alternative methods. For the outpatient areas of care, virtual modalities are being maximized with MAS and clinical staff reaching out to our veterans to meet their healthcare needs using alternative methods. This is a high-level overview of what is being done within the healthcare system, and there is likely much more being accomplished in your work areas to decrease the risk of COVID-19. The patients who are expected to become very ill due to this virus are counting on our healthcare system. While all these changes and increased expectations have created some inconvenience, they are necessary sacrifices. It will last longer than any of us want. This is not the work life we expected, but that's okay. Why ask so much of you? Because that is the only way to save lives. All of the planning, changes, and extreme measures we have taken may feel excessive. If we do this right, nothing happens. That's right. Success will be measured when nothing happens, when none of our employees spread or contract the virus, when we have enough ventilators to care for our patients, when we have enough staff to care for the most vulnerable patients. That will be our success. As you take care of others, please remember to take care of yourself. We need you today and for the long haul. Don't ever forget the difference you make every day with everything you do. We are here for you and with you during this unprecedented pandemic.
On March 23rd, the Mayor of San Antonio issued a stay home, work safe order for San Antonio beginning at 11:59 p.m. Tuesday, March 24th and lasting through at least April 9th. The order applies to all of Bexar County. Essential businesses allowed to operate during this executive order includes healthcare workers. Work at the medical center or supportive to the medical center is considered by definition essential. For employees within South Texas Veterans Healthcare System, it is necessary for healthcare operations to continue. Although some positions may be eligible for telework, other positions are necessary to be performed at their respective medical centers or outpatient clinics. Because law enforcement personnel will be enforcing the mayor's order, it is critical that employees have their personal identification badges when traveling to and from work. Please use this letter if you are asked why you are working when others stay at home. When you are traveling, ensure that you have your PIV card with you. The PIV card will be your official identification as a VA employee.
I wanted to take a few moments to tell a story about how our response to COVID-19 is reshaping the experience we provide our veterans. This example comes to us from our Community Living Center at the Kerrville campus. In our Home of the Brave neighborhood, we have a veteran who has lived with us for 2 years. His wife had been visiting him nearly every afternoon, most times sharing dinner with him. As we moved to a no visitation policy, her routine visits with her husband were to shift to virtual. She did not have access to a smartphone, but did have access to a computer. Our multidisciplinary team of nursing, social work, and MAS worked with her, but she was initially unable to make the connection. However, the team was persistent in our efforts to make this work. The nursing team sought out assistance from voluntary service, who arranged for a volunteer to meet our resident's wife and help her connect from her computer on Sunday, March 22nd. We had been successful. Our resident and his wife were able to connect. This virtual encounter was a touching sight for our nursing staff to witness. It was also a very special moment for our veteran and his spouse, who blew kisses to each other and made a few funny faces as well, all virtual. This very necessary personal encounter was made possible because of the determination of the entire team. nursing, MAS, social work, and voluntary service.
Great job, those guys. Great job.
There are stories like this all over the healthcare system. We are proud of all of you who are overcoming so many barriers during this very difficult time, and who are continuing to provide care and experience that is second to none. What you are doing is nothing short of heroic.
As you've heard, there are many people in this organization that are working very hard every day of the week to ensure that we are maximally prepared for every possible scenario. We've also been working to protect and help you, the employee, in this situation. In particular, some changes we've implemented are the resource page on our homepage. If you go to the homepage and click on the COVID-19 icon, there's a link to a page full of resources and information related to COVID-19. We are also exploring additional ways of making information readily available to you when things begin to change more rapidly. Social distancing has become the norm, and we've implemented that here as well. This includes transitioning the canteen to takeout only, canceling major events, and placing signage on chairs and waiting rooms to ensure that folks are socially distanced. Virtual care, as was mentioned earlier, is another methodology that we're using to help our staff and the patients to keep that distance by allowing virtual and telecare as much as possible and rescheduling appointments as needed. And telework. Concerted efforts are underway to allow staff to telework when feasible. We need many of you here at work to assist in all of the efforts that we have going on. But in cases when you can work from home, we'd like to allow you to do that. We're aware that there is not currently enough bandwidth to support the national increase in telework. IT is aggressively working on increasing bandwidth, and we expect to see that improve soon. And then finally, childcare. With all the school and daycare closures, many of you are facing challenges finding reliable care for your children. There is a team that is actively and creatively exploring options to assist you. In addition to the changes you've seen from the command center, we need you as well. We greatly appreciate all the hard work and dedication in our response to this national crisis. One thing you can help us with is the critical international shortage of personal protective equipment, or PPE. This includes face masks, face shields, goggles, gowns, etc. We're asking everyone to be conservative in the use of these items and be vigilant in the protection of our supplies. We've already seen several examples of creativity and stewardship as your peers have worked to protect our precious PPE. And remember self-care. Stay rested and positive. Keep your spirits up and help uplift your coworkers. Together we can face this invisible enemy as we have many before.
Absolutely. So thank all of you. That's it for this edition of the South Texas News. I want to thank you again for the amazing work that you're doing across the healthcare system. If you'd like to stay up to date with our command center activities, you can do so by visiting the COVID-19 link on the South Texas Veterans Healthcare System homepage. We'll see you in the halls. Thank you. Bye.
Bye.